Did you know that over 70% of Americans regularly wake up at night to urinate? And contrary to popular belief, this is not a normal part of aging. In fact, it's one of the most overlooked signs of a deeper health issue that conventional medicine completely misses. Hello, I'm Dr. Stephen Gundry. As a former cardiac surgeon with over 40 years of medical experience, I've helped thousands of patients solve this frustrating nighttime problem without drugs or surgery. And today, I'm going to show you exactly how I do it. In this video, you'll discover why your bladder issues are likely connected to your gut health, the surprising foods causing your nighttime bathroom trips, 3 simple solutions you can implement tonight, and the hidden brain damage that occurs when your sleep is disrupted. See that shocked expression on my thumbnail. That's how most of my patients react when I tell them what's really causing them to wake up to pee every night. It's not what your urologist is telling you. Let me tell you about Bob, a 62-year-old patient who came to me after his urologist recommended prostate surgery. Bob was getting up 4 or 5 times every night to urinate, leaving him exhausted and irritable during the day. Does this sound familiar? Are you waking up multiple times a night to use the bathroom? If so, drop a comment below with how many times you typically wake up. I'd love to hear your experience. Now, Bob's conventional doctor did what most do, blamed his enlarged prostate and suggested either medication with sexual side effects or invasive surgery. But when I examined Bob's health history and ran specialized testing, I discovered something his urologist completely missed: severe leaky gut syndrome. Here's what most doctors won't tell you. An enlarged prostate affects over 50% of men by age 50, and a staggering 80% by age 70. But this isn't a normal part of aging, it's a symptom of something deeper. You see, your body is a connected system. When your gut barrier becomes damaged, what I call leaky gut, bacterial particles can escape from your digestive tract and travel to nearby organs, including your prostate in men and your bladder in women. These bacterial invaders trigger inflammation, causing your prostate to swell or your bladder to become irritable. And guess what happens then? You're up all night making trips to the bathroom. The conventional approach is to treat the symptom, the enlarged prostate or irritable bladder. But my approach: fix the root cause, your leaky gut. If you're finding this information helpful so far, please hit that like button. It helps others discover this critical information that most doctors simply don't know or won't share. Now, what causes this leaky gut in the first place? The answer might surprise you. It's often the healthy foods you're eating. Let me introduce you to lectin's plant defense proteins I call edible enemies. These proteins, found in foods like nightshades, legumes, and whole grains, are designed to protect plants from being eaten by creating holes in your gut lining. For women specifically, bladder irritation is often triggered by aquaporins found in nightshade vegetables, spinach, corn, and soybeans. And no, you can't remove them by peeling or deseeding. Another common culprit: factory-farmed chicken. Most conventional chicken is contaminated with E. coli bacteria that can migrate from your gut to your urinary tract, causing chronic, low-grade infections that keep you running to the bathroom. I've seen hundreds of patients eliminate their nighttime bathroom trips within days simply by removing these lectin-containing foods. And this is what most urologists and primary care doctors will never tell you, because they're not trained to connect your diet with your bladder health. But there's something even more serious we need to discuss. Every time you wake up to use the bathroom, you're disrupting one of your body's most critical processes, your brain's nightly cleaning cycle. During deep sleep, your brain activates what scientists call the glymphatic system, essentially a power wash for your brain that removes harmful proteins like amyloid and tau that are linked to Alzheimer's disease and dementia. Here's the shocking truth. Research shows that fragmented sleep from nighttime bathroom trips can cause the same kind of brain damage we see in early Alzheimer's disease. This is why fixing your nighttime urination isn't just about comfort. It's about protecting your brain health. Many of my patients who resolve their nighttime bathroom trips report dramatic improvements in memory, focus, and cognitive function within weeks. This connection between bladder health, sleep quality, and brain function is something you simply won't hear from most healthcare providers. So what's my protocol for ending nighttime urination for good? Let me share the three-step approach that's worked for thousands of my patients. Step 1. Heal your gut barrier by eliminating lectin-containing foods for at least 30 days. My Plant Paradox program outlines exactly which foods to avoid and which to enjoy. Step 2. For women specifically, supplement with D-mannose, 500 mg twice daily. This simple sugar binds to E. coli bacteria in your urinary tract and flushes them out safely. It's more effective than cranberry juice and doesn't contain sugar that feeds bad gut bugs. Step 3. Create a proper sleep environment by avoiding all food at least 3-4 hours before bedtime to ensure blood flow is directed to brain cleaning, not digestion. Sleeping on your left side to reduce pressure on your bladder. Using a specialized pillow to prevent snoring and sleep apnea, which are major causes of sleep disruption if you're hungry before bed. I recommend a teaspoon of MCT oil rather than foods requiring chewing. The act of chewing signals your digestive system to divert blood from your brain, disrupting that crucial cleaning process. After implementing these changes, Bob, my patient I mentioned earlier, stopped waking up to urinate within just 10 days. His prostate size actually decreased by 18% in 3 months, and his cognitive function tests showed significant improvement. Remember, waking up to urinate is not a normal part of aging. It's a sign your body is trying to tell you something important about your gut health and inflammation levels. Tonight, I want you to try one simple change. Stop eating at least 3-4 hours before bedtime. Many of my patients see improvement from this single change within just a few days. If you found this information valuable, please subscribe to my channel. Next week, I'll be revealing the forgotten link, how your gut microbiome controls your brain health, where I'll show you the specific foods and supplements that can dramatically improve your brain function by optimizing your gut bacteria. The connection between your gut, your bladder, and your brain is one of medicine's most overlooked relationships. But now that you understand it, you have the power to transform not just your sleep quality but your overall health. This is Dr. Gundry, helping you live your best life by making the right choices for your body. I'll see you in the next video.